Girl Scout leader, sparked her passion for nutritional counseling and the herbal arts. She often recommends lifestyle choices to improve the oral and systemic health of her patients, and in recent years has been the only dentist in the Atlanta area to offer a variety of functional orthodontic appliances and light therapies for patient care. Please welcome Dr. Amy Dayries.
Thank you. I'm so impressed that y'all are still here Friday afternoon and we're in Vegas. So I'm going to try to make this entertaining and maybe somewhat interactive. Can I have a show of hands for anybody out there who might currently use any light therapies aside from lasers? But you could raise your hand if you have lasers. Anybody? Okay, that's good. So maybe sound therapy. Anybody out there using sound therapy? It could just be the music that you play. That's cool. So we've had some good music the last few minutes. Yeah, I'd love that. Thank you. Thank you. Wonderful. So I'll get the hang of this mic and how this slide presentation works. Everywhere you go, it's a little different, and you always have to be able to be flexible. I'd like to thank Griffin Cole for inviting me to speak, and this will be fun, I hope. I'm a mom, as was mentioned, and I'm about to show a video to everyone here, and when I got so excited when I saw it, because to me it was a really neat way to explain how sound can be a wave and light can be a wave. And I came home and I told my kids about it, and they're like, Mom, we already saw that in school. But for me, it was very revolutionary, and I hope you'll enjoy it. And it's pretty good music as well. It's by Nigel Stanford. And here we go.
The film you're about to see has no characters. If you spare a little of your imagination, it is a film to describe to you the effect of cymatic frequencies on matter. Everything owes its existence solely and completely to sound.
I just think that's super cool. So we interact, our cells are also going to react to the environment we're in through sound and light therapy. That could be through lasers, it could be through natural light, and our cells are going to respond on that cellular level. You can see throughout nature examples of wavelengths. So I love that picture on the left there. It's a bird breathing, and you can see there's a rhythmic visual existence to the breath, to the exhale of the bird. Of course, we have in nature, we have waves, and we even in our blood vessels have a rhythmic motion of how our red blood cells pulse through our arteries and veins. It's a spiral. So we also might be familiar with wavelengths for sleep and dentistry, and also the heart rate. So I wanted to talk today about using sound therapy, light therapy, types of light that we can see, types of light that we can't see, all different applications, so that you can go back to your office on Monday and maybe try some of these. And there's so many different price points for these things. They can be as simple as wearing some colorful sunglasses to listening to good music, or maybe trying some of these devices that we've incorporated in our practice. And the main reason I wanted to do this is actually my curiosity got piqued a bunch of years ago now. I was doing an integrative medicine fellowship, and I came across this article from the 1940s, and it was about how in Germany they were using infrared heat lamps to help with sinus infections. And I think, gosh, all the time I see people that come in with upper toothaches, and it'll possibly be a sinus infection. So that's where I started, was buying a Boyer, that's spelled B-E-U-E-R, infrared heat lamp off of Amazon, and just trying it. And I know my office thought I was crazy, but the people left feeling better. So at that time, those lamps were $55. Now I think they're about 88. I really should sell them. But you can use them anywhere on a patient that doesn't have broken skin. So where there's aches, think of like TMJ pain. What the infrared light in that situation is going to do is promote blood flow to the area, which is why you wouldn't want to use a light like that on broken skin. And at that time, when I purchased my first infrared heat lamp, I wasn't into gadgets. Now I'd say I might be a gadget junkie. But the review on Amazon was that these were as popular in Germany as a toaster oven. So I just wanted to know more about that. And then it started there, and it also, we have tripled our practice volume in the last several years because we've offered services like this, and they're unique to the area, and I'm telling you, you can too. And it was a way to help duplicate me, because I'm a bottleneck. So a lot of times my admin, my team can help with using some of these therapies on people while I'm not in the room, while we're trying to figure out what to do, maybe while I'm checking hygiene, maybe I'm finishing a restorative filling or something in the other room. So what we do know is that all types of emotions, even when they've been able to freeze snowflakes, they can appear different one from another. You might notice at the bottom there, there's polluted water and non-polluted water, or after there's maybe been some sort of a prayer said over the polluted water, the structure of that can change. We also understand now through technology, through our evidence-based medicine, that even a human cell can make a sound. It may just be outside of our range of hearing. And we know that plants talk to each other. The trees, the roots where they come together and interweave together, they communicate to each other. And you might notice or have heard of 432 hertz music. Actually, there was supposed to be music on the slide. It didn't come on and... Oh, there it is. Thank you. So this is an example of 432 hertz. And if you have anybody that's very anxious in your chair, you can easily go to YouTube and find some music. Some of it has more melody than this. A common pop song that's 432 hertz is Strawberry Swing by Coldplay. And you can find some cool playlists for your office of 432 hertz music. There's also something called the Schumann resonance. It's another sort of sound technology that can relax people and also cause healing. And how do they know it heals? They've examined blood cells through histology and have found that the structure is literally different afterwards. I'm going to keep on progressing here. So one of my next purchases was this gizmo called an AMI 750. You can see us operating it up here on this video on the upper right, of the slide. You can kind of hear it. It's a little bit cacophonous, or there's actually 5 different sounds being played all at the same time. And the idea is you put your feet on these things that are really like blue ices. And I have had people that maybe come in with a toothache. We're trying to decide what the next treatment is going to be, but they're hurting. And it's very hard for somebody to make a big decision, like maybe getting a tooth out while they're hurting. They can put their feet on this while we're trying to get our act together and figure out what we're going to do. And a lot of times it helps them be able to think more clearly. There's 10 settings on this AMI 750 machine, and they've recently come out with another one. This is where they've actually engineered the reverse. You saw those snowflakes. Well, they've been able to take the crystalline structure of chemicals like oxygen and ozone and turn them back in reverse into a sound. And that's what you're hearing with the AMI 750, and it's really, really simple to use. So any of my team can use it. No one's getting hurt, and people really feel much better. You have over 70,000 different points through the feet that this is reaching. So it's like giving a dose of ozone, for example, without any sort of injection. They also did a study using this technology in 2019 where they took 2 samples of a woman who had O-positive blood and put her blood sample in, exposed it to the AMI 750, and the other sample was not exposed to anything. It was put in a Faraday cage. And they evaluated it and compared that blood sample after 19 to 20 minutes of exposure to the AMI 750. And it had an increase of 3,400,000 red blood cells to that sample. And the one that was in the Faraday cage, that sample did not have but about 900,000 increased cells. So it seems to also contribute to cell regeneration and healing. And they did do some dental studies where they were finding inflammation in the jaw and how it might be located in the breast. And what they did is they would have somebody come in for 20 to 30 minute sessions a couple of times a week for about 6 weeks. And they had great improvement in overall inflammation through the lymph tissue. So I guess it's daily sessions, but we don't have somebody come in so much for daily sessions, but I often will use this when somebody comes in for a toothache, or maybe they've had back pain in your chair. So you can easily put it at the end of the dental chair, maybe put it under, have a couple of bolster pillows underneath or a blanket underneath to prop it up so their feet are against it. So think about all those patients that have chronic back pain and you need to finish a dental procedure. They're just so much more comfortable. And I wanted to also talk about light therapy in the dental office. The top 5 that you often will see literature about in evidence-based medicine is blue, UV light, far infrared, near infrared, and red light therapies.
This is my acupuncture man. He shows the various meridians that are taught in Chinese medicine. We are like batteries. So for instance, if you take the the gallbladder meridian, it starts along the pinky toe, meanders up the side of the leg, up to the serratus anterior muscle here in the abdomen, and then it also wanders along the tops of the trapezius muscles up through the back of the head, and then reconnects all around the skull. As you'll see with some of our laser work, you can treat the forearm and the hand, which is going to be connected to your stomach and small intestine meridians, and you'll end up creating relaxation again in the jaw and in the face. And it's like you tug on one end, it's like a fishing line. You tug on one end and it affects something somewhere unrelated. That's how these meridians work.
And there actually is a vendor who has repeatedly come to the IAOMT. I noticed him about 6 or 7 years ago and ended up getting a gadget from him. He has something called the Nano Herb Light, and I highly recommend it as well. I've had people with dental toothaches, abscesses come in where they have a lot of swelling, acute swelling, and they'll use the herbal light, which is infused with his nano water. It's an energized type of water. and also some Chinese herbs to help with inflammation, and it'll actually draw the infection to a head where it actually has sometimes popped, again, while we're trying to figure out what we're going to do, what the patient's going to finally decide. And so if you do take any classes with him, and what I was mentioning here about the meridians, they teach in Chinese medicine, but also in Ayurvedic medicine, which is the typical form of medicine in about 2/5 of the world, quite a lot of the world's population. That there's 5 different elements, and there's diets and lifestyles that can help beef up or bone up certain problems or decrease certain problems and bone up the health of people with various constitutions. The teeth are connected with this, and also the tongue. So you'll see in those cultures, you'll also see tongue diagnosing and an understanding that the teeth really are like a switchboard. And so when you're having a dental toothache, sometimes it's actually being contributed by the organ that it is connected to because of that meridian system. So the nano-herb light, it seems to be affecting and improving the DNA and healing DNA. It's not a laser. It's using herbal medicine without prescribing or giving somebody any herbs. And it's very convenient to use in the dental practice. Again, an adjunct team member can use this if you're busy, or you can use it, and you expose the tissue for about 3 minutes to that light for that problem. So there's one for organs, there's one for tumors, there's one for pain, there's one for skin and hair. And I'm also just trying to show the connections. They've also done studies, Dr. Dietrich Klinghardt has done studies in Europe on some of this, about how if you're maybe missing certain teeth or having problems with certain teeth, those can be also connected to specific emotions, again, through this meridian system. So it's a spiritual, emotional, physical presentation that a person can have, and how you can affect it with light. Also, you'll see in these systems, and a mention in these systems to something called pulse diagnosis, tongue diagnosis, and you'll also look at the skin and the eyes, which tell a story about the constitution of your patient. And so, the eye here on the lower right is showing fatigue. It's got this line right here in the corner of the eye. And I just thought it would be interesting. You know, we were taught in dental school about where the different taste buds are, and I think that's kind of an interesting thing when you appreciate where the organs and the meridians and what the tongue might tell about the teeth. And then this is just another way to explain how if you're trying to bone up or decrease the influence, for instance, of fire, which can happen to like a young adult. Think of a young adult who's maybe rebelling. It's also associated with the wisdom teeth, for example, and heart and small intestines. And again, I mentioned tongue diagnosing and where the tongue is in terms of meridians. I find this very interesting. So you can use a light, like I was showing you, or maybe you do already have a laser. You could use any sort of light and bring sometimes healing to the various tissues through these meridians that we run on. And I mentioned that they have also looking at the fingernails. Doesn't work as well when you have a woman with a manicure. And also with that tongue diagnosis, you can look at whether somebody is yin deficient, if they're very weak, for example, like in the upper right photograph on the darker blue area of the slide, or if they have too much masculine or yang, or too little yang influence. And you can, again, actually with his whole system, he makes it very, very easy to talk with people about herbs, even if you don't feel like you have that much of a background. I find it very easy to use. And also my team does too.
Next.
This is how quick it is for him to get a diagnosis with his system.
New system.
Next.
Yes. Last intestine.
I don't work for him. I just believe in his technology. He also tests all of his, if you like his supplements, he tests all of them for heavy metals.
Liver.
So he tests the hands and the feet. He's broken down about 400 different acupuncture points into about 14 places. And then from that, he's able to get
Brother.
a report generated, sort of like this. And I find if I'm going to do maybe extensive treatment, for instance, in our office, we do a lot of functional orthodontic appliances that also can promote sleep. If I have somebody that's got a lot of hidden gut issues, maybe they're not stable enough to start just yet. It helps me to understand better and on a deeper level who I'm working with. And you can do another test. You can have somebody come in and use your light a few times a week, and we do sometimes have that happen. I've used it a lot when I have somebody with shingles or TMJ pain. This clicker sometimes seems slow. This one, thank you. That might work. Thank you. So there are connections between the teeth and the organs. This is when I use it when I have TMJ pain, swollen gums, paralysis, I suppose, gum issues. He even recommends it for sleep issues. I often will also do something called night lace. People with a laser might have heard of that, but you can use a light, a natural light back there as well, in the back of the throat to help tighten tissue. So I really have used it a lot on people that have shingles and sometimes people with vertigo. And really these types of therapies have really generated another whole income potential for the office. And it takes very little doctor time, and people like it because it's natural. So he's reduced, like as I said earlier, many acupuncture points into 17, and you're not using any needles, you're using a light. It takes about 3 minutes for a treatment because that's how long it takes for the blood to recirculate through the body. And I wanted to mention the light because in this, I know we just watched this video, but I brought it up again because the light part, we're not going to watch the whole thing. It was intended to start at the 3-minute mark. You might have noticed when they brought the fire out, so to speak, that there was a pulsating action with the light. And anything and everything is made of light and sound. It's just sometimes we can't see some of it. So then it's hard for us to believe that it's really there. But I loved that video because with the light, you saw that flame could actually pulsate with the light. And when we're using light that's infused with herbs and water, it's an energetic type of water. It's a very clean water. You can actually get a lot of change to the DNA. So this is just highlighting again where he uses the light. I have a lot of slides. I'm going to move on through this. But he uses it also to regenerate hair. I haven't used it for that as much, but I have used it very, very often for pain management. And we do have people that have styes, facial rosacea, things like that. It can be very helpful. There's a blue and a white light, and you'll see later in this presentation that with blue light, it's very helpful to relax people. It's a mood elevator. It also can help break down hyperpigmentation of the skin, which is also why it can be good for shingles. And I have only used it on a couple of people that have had skin cancer, but I'm not having people come in for this for skin cancer exactly, but if they're already in my office and they have a place while we're waiting to numb, it's an appreciated adjunct treatment. And you will find some other books and literature out there. Sometimes we'll use in our practice the Bach flower remedies. I like a lot of homeopathics and herbals to support healing. So this book is written by somebody who's down in South America, using a little bit, either giving the patient a few drops of Bach flower remedies to ingest can help with their countenance and emotional health. For instance, if they're very sad or they're weepy, Star of Bethlehem is a very helpful Bach flower remedy. If they've had a lot of irritable bowel issues lately, Agrimony is a nice choice. And if they've been fighting an illness, the Bach 5 remedy of 5 is a nice choice. And Dr. Bach, who invented those, was a British surgeon who left his surgery practice to use these remedies. He would walk along the moors, and these are various flowers that grow in the hedgerows, and he would harvest them and put them in actually a glass of water, and then harvest that flower water, is what I call it, and preserve it with a little bit of brandy. So they're they're mostly water, very safe to use for kids as well. So more about light therapy. We use the Saluma light. You'll notice probably a lot of spas in your area like this as well. It's very, very easy to use. We wheel it into our operatory. It has red, blue, and green light settings on here. It also has a pulsating action, so I don't use the pulsating action on everybody. You know, if they're like epileptic, you don't want to do that. But it's about a 20-minute timed. It turns on off by itself. We use suntan glasses, you know, those little bitty beady looking goggles, and then a sleep mask over that so that it seals up the eye, protecting the eye. But this is very excellent to use when you have somebody that's got headaches, TMJ pain. I've had so many people have falls and accidents. That's actually what prompted this. After COVID, I had so many people having these random falls where they'd end up with a concussion. And I was looking for something, again, to support them. You know, it also can be very relaxing and relieving when they've come in with a traumatic injury on their face, maybe even fixing their front tooth that they broke. And this is a really nice, relaxing way for them to end the appointment. It's also got a setting for acne. So the teenagers like that. I've also used it for tear-side bleaching. When you have somebody that's wanting in-house bleaching, it'll get all of the teeth and help with wrinkles at the same time. What's not to love? And so this is a very typical example where we might do what I call the pinky test, where the patient bites down on my pinkies or theirs. If they come in with TMJ pain, a lot of times the medial or lateral pterygoids are hyperactive, and we want to reset those. So we go through some instructions and send the patient home with instructions on how to relax that tissue, and we will also back it up with using some light exposure. And I'm telling you what, they leave feeling so much better, and it's again, not a lot of doctor time. So, you know, we definitely still take x-rays, we do an exam, and then I'll oftentimes have them follow up with a bite guard. But a lot of times when you treat them with that light and we invite them to come back for more light treatments, they'll come back. They feel so much better, they love it. It's also very good on their pocketbook a lot of times. And I've had a rash. I don't know what happened, but we've had probably 15 new mothers come in for this type of therapy since like Valentine's Day. It's been insane, just the people that come in. So we also do cranial release therapy. You can get associated or pass the test, get certified, that's what I want to say, with the American Academy of Craniofacial Pain. And this is a little video showing what we'll do with people right after longer dental appointments. And again, it can support that TMJ, help support when they have a sinus infection or maybe a history of a car accident. It's very, very gentle pressure. There's no cracking or twisting, anything rapid, but we'll oftentimes use this little technique. It takes just a minute after any sort of longer dental appointment, whether or not you're using light therapy. Here we go. Can we play that? Are we able to, let's see. I think I can. This is that video I'd like to play.
Today I'm going to show
Here we
you
are.
how to do a cranial release technique that's very helpful to relieve headache or sinus tension. I also might use this technique frequently at the end of either a longer hygiene exam or a dental appointment. It takes just a couple of minutes, and it really brings a lot of relief from tension that the patient's been carrying in their head and neck, and again, it can help relieve headaches. So we're going to be placing our middle fingers at the back of the skull, where there's on everybody a natural bump. It's where the occipital and two parietal bones come together. and we're going to be allowing the patient's head to just gently rest on our fingertips. So here's our patient. We also want them to start out with their arms and their legs uncrossed. So if you don't mind, please uncross your ankles. And now I'm going to ask you to please have your head rest on, we're locating that bump. And she's going to allow her head to rest on my 2 fingers. And it really doesn't look like there's much action going on because this is just an isotonic hold that we have on her head. But what you'll notice as the practitioner is that there's going to be a bouncing motion, a rocking motion. And what that is actually the pumping action of the cerebral spinal fluid. It starts from the ethmoid sinus area, which is located behind the, just beyond the pituitary gland. There's an area where this pumping action starts. They call it the sella turcica inside the skull. It goes all the way down to the second sacral vertebrae. Once we've allowed the waters, so to speak, to still here, we're going to move our hands up the back of her head. And again, we're going to feel a pulsating action. And once it has slowed down, we'll actually let our fingers wander a little further up. And once this has settled, we're going to go down to the nape of her neck and place your hand at the base of the skull on each side, and you're just going to gently pull up. Gently pull up. And you'll have patients say, you know, I'm feeling more relaxed. How are you feeling? Great. Okay. And obviously we're making a teaching video here, so, but honestly, you'll have patients tell you that they really do feel much more relaxed. And as you get to be more experienced with this is a certification course you can attend with several different organizations out there. But you know, sometimes you'll notice tension in the upper trapezius muscles. So I'll put a little isotonic hold here and stretch here if you notice that a little bit. If you do one side, always go bilaterally and do the other side.
So, you know, a tight muscle is going to feel like a rubber band. Anyway, that's just a really
I might
quick.
work on this and do this type of hold for 5, 10, 15 minutes.
Yeah.
Depends on the tension. Once I'm done, I disconnect my energy from hers, and I ask, are you feeling dizzy at all? And if they are, then we pause and we do a little hold on her forehead. And that's it. Thank you so much.
So we use that in conjunction with a Solumalite, again, for concussion therapy, TMJ pain, fatigue, when they're just really sore or they've been sitting in your chair for a really long procedure. And actually, I was going to present that up in Chicago last winter before I got hit upside the head with an umbrella at my table where I was having dinner with a couple of my girlfriends. So I got to have my own concussion and try some light therapy on myself. So the pictures on there's a pair on the left, there's a pair on the right, and there's about 20 minutes of difference between one photo and the other. But I was using some red light therapy and blue light therapy. And I do believe I would feel a lot less swollen, and I just felt better. So I wanted to talk about the different colors of the wavelengths. Blue light therapy is oftentimes associated with improved mood. Think of like blue light at nighttime. You don't want to have a lot of blue light, so your phones turn over into more of that orangey light because it's a mood elevator. It kind of stimulates, hey, the sun's out, let's go out, let's wake up and be energetic, which you don't want so much at night, but it can help people feel better. It also is used for acne. It seems to be able to kill the bacteria cells that are in a little bit subepidermal and prevent additional acne from coming up and coming out. It's also good for broken capillaries, somebody maybe who has like rosacea or lupus. Green light therapy, think about it being associated with like the heart chakra or the heart, or forest bathing. It's been shown to help relax people. It's actually helpful to induce sleep. They did a study in rats, which isn't maybe so great, but the rats would fall asleep and typically 1 or 2 minutes after being exposed to green light therapy. So it might help somebody who's slightly got insomnia. You can even get color therapy glasses. And so it just seems to be helpful and simulate like that forest bathing that has been shown to heal women with breast cancer. There was a study on that, on Japanese forest bathing with women that had stage 3 and 4 breast cancer, and a lot of them got well. And they studied it for headaches and dentistry. So on average, well, maybe not specifically dentistry, but they studied it for migraine headache sufferers. And it does seem to help with the photobiomodulation with the green light wavelength. People that on average had headaches 21 days of the month, they cut it down to less than 7. Typically, most of those candidates were only 2 days a month of migraines. And you might also remember that a lot of migraine sufferers have that prodromal phase where they are aware that they're going to get a migraine either through their eyes or ear sensitivity. Red light therapy, it's the most studied. There are literally many thousands of studies on red light therapy. Remember, the one I initially wanted to use an infrared heat lamp on was written back in the 1940s. And actually about 100 years ago, there were a number of French scientists that were doing lots and lots of work on color therapy before World War II. But if you go back actually thousands of years, you'll see records of light therapy that the ancient Egyptians were studying, and in the Vedas, in Hindu culture, Ayurvedic culture, there are notations about using various colors of light therapy. And somebody mentioned earlier in the nitric oxide talk, one of the best types or ways to get some red light therapy is through your sunlight. And what we believe that the main mechanisms of action, because a lot of this light therapy, people are, well, how does it work? But it seems to increase your mitochondrial energy production. And specifically in the 4th phase, something called oxidative phosphorylation is what it seems to really affect and promote. And hormesis, it also helps with hormesis, building up the cell's antioxidant and anti-inflammatory defense systems. It can also help with nitric oxide that we heard about in the last lecture. So it's been very helpful for post-surgical pain, and it seems to reduce pain in one study by as much as 50%, has reduced the length of healing time, has increased joint mobility. This was done on a study with patients who had had knee replacements, and also people who had had recurring pain. There were longer time periods where they were actually pain-free with increased mobility and ability to go out there and exercise. So easy to incorporate in your practice. Remember, my first infrared heat lamp, which is going to have some red light and some infrared, it was only at that time about $55. They're about $88 or so now on Amazon. And I always encourage my patients to maybe get their own, especially if they have multiple family members. And if they're going to use it, for instance, on their sinus or where they have muscle pain, you just don't want to use it on broken skin. And if they're using it around their face, I always have them wear sunglasses, sometimes a double layer. But you should get this in your practice. The first thing I bought, remember. And so what I'll do is I'll park it on the little dental table there, or sometimes I'll elevate a chair and it'll be parked about a foot away from their skin. It's on a timer. It has 2 buttons. It's hard to mess up. One's the on-off button, and the other one is a timer. You can use it multiple times. And do you all know that feeling when you get out of the bathtub and your body's just, or a hot tub, and your body's just emanating this heat? That's what it feels like when they've exposed their muscles, their face, to the infrared heat. It's just that you can't soak your head in the bathtub. So it's a nice alternative to doing that. And they've also done a lot of studies about skin health, helps with wrinkles. Again, I use that Soluma light when I'm also doing in-house bleaching. So they've got their mouth open and the light is folded over their entire face and neck. And I've had so many people have falls and other things. So the picture on the left is a guy that had fallen And I think you'll feel like the redness is more, I know he doesn't have sunglasses on in the second picture, that was maybe faulty camera taking, but I think you'll see that there is a concentration of redness where he had fallen and bumped his nose and had basically 2 black eyes. And then a few months later, he was all healed. But he left feeling much better after about a 12-minute exposure to my little light. That's that Boyer light that you see pictured there. And we also in our office, using some light therapy and the sound therapy and the herbal lights, it gave me a lot more courage in myself and the ability to how I could use a laser, which is of course many, many times more in terms of dollars. And I had to take a loan out for that, where the other things I could just buy outright. But some studies actually suggest that natural lights, things that are not so focused and concentrated like the laser is, actually may be more effective or just as effective. So I just want to say, maybe try some of these things. You don't have to have a lot in it to try it out. It's very practical for the dental office. And so, I do use laser therapy on soft tissue lesions, and this was just a little mucosal we had, and within a few minutes, initially when the laser's used to heat up the tissue, you'll experience some dehydration of the tissue. But in this case, it actually had popped slightly and became a lot more concentrated. And I think that's what you see a lot of times is maybe a reduction in swelling with any sort of light therapy and a focus on where the source of the wound is. And recently, I had taken my dog to a holistic vet, and she was using a contraption similar to the one you see up at the top, which is about a $2,500 laser. It only is about a 4-minute treatment. It's also used for people. It is. Why are dogs so different than people? So my front office manager had hurt her wrist, and she took it home overnight, and the next day, her bruise was a lot more broken down, and she had used that little laser about 3 times. So when I have had somebody with a lot of pain, or maybe I've had so many people with falls, if I trust them, if I've known them, I'll even let them take that home. I have one like that. And this is another version of something like that. A patient showed me this one. These retail on Amazon for around $150. There's 2 versions. There is the so-called professional version and the regular one. This is the professional one. And it's, again, a red light. It looks like a red flashlight. And you can use it on TMJ pain. I had a patient who had a front tooth removed, a failed root canal, and she found this to be very, very helpful and soothing for herself post-surgery. And using low-level lasers is similar to acupuncture. So they did this study published back in 2021 where they exposed the forearm, and I referred to this earlier in the lecture. They exposed different parts of the arm to laser light therapy, and through the meridian system, they actually found that the patient had, throughout that whole meridian, a lot less pain. It breaks down trigger points is the point of this. I also wanted to mention that if any of you all use the HR5 test in your practice, that one of the suggested treatments by the HR5 company is using low laser therapy as a treatment for certain bacteria, if this is your bag. Not everybody does this, but we have found some success, and some of my physicians that I work with have also, some of those have cold lasers or laser therapies in their medical practices. So they've also been backing me using, when the patient comes in there, we're using it and they're using it. So the patient's getting it from 2 different places. So if any of y'all have heard of a trademarked name, it's either called Oralace or Baby Lace. It's using a laser. Synergy Institute out of the St. Louis area teaches this on a regular basis, but you're basically using a Fibonacci sequence with your laser light, In other words, like a nautilus shell. It's a swirl. And they have found that that can help break down trigger points, again, for face, neck, shoulder pain, upper trapezius, TMJ issues. And then, of course, you can use lasers for collagen production. You can also use infrared and red light therapy for collagen production too. And the photo on the far right is about a month after. The photo in the middle is 20 minutes after the photo on the left. And you can also use lasers for night lace if you haven't seen that before. And we use the Lightwalker laser at our office. This is about a 20 to 30 minute session. And after night one, about 50% of patients find that they breathe a lot easier when they're sleeping. Initially, they leave and the tissue feels warm. During the process, there's no needles or cutting or numbing, but it feels like the tissue has been exposed to maybe like a hot drink, like a hot cup of coffee, and it helps shrink, or it re-stimulates the cell's ability to make collagen. So the tissue generally shrinks back and tightens up. It's typically intended to be used in a series of treatments. And I just wanted to touch on, Dr. Tennant has presented here at the IAOMT meetings a number of times, and he is famous for the Tennant meter. He was an eye doctor, helped pioneer LASIK eye surgery. His Tennant meter treats your body like it's a battery. It's using wavelength technology. There's also a special contraption that produces a scalar wave, and it can really help soup up or get that wavelength technology and healing ability deeper, deeper, deeper into the tissue. You do expose bare skin to it, and he's written that excellent book, Healing is Voltage, if you're looking for good reading material. You want his meter, it has two parts, at least two parts to it, really many, but initially you can measure the different places on your body that's like a capacitor, and then recharge accordingly. So we're almost done. That was just a little bit about PMF, and then just a couple of more easy things. You can use a chi machine. They did a study on soccer players in Canada who had all had concussions. You put the ankles on this for about 20 minutes. It can be done in a dental chair on somebody that's come in for a concussion. Helps with promoting short-term memory, daytime focus, and they sleep better at night. And the Resi-Max tuner is another contraption that you can have a patient check out who's having acute muscle pain. And you can get your office staff SAD lights for seasonal affective disorder. And then this is one of my favorite things. We have all of our patients use these light color therapy glasses. It's relaxing and fun and a conversation piece. And that's really it. It's really turned a whole other production for our office and helped us continue to grow. And I don't have to be in the room the whole time. So I hope this was just some helpful ideas of how you might grow your practice. Thank you.